Hello, friends and family and community neighbors. Today, I wanted to talk about something that has really touched my heart over the past year and a half, and it's really focused on us as people, us as community, us as being good neighbors to each other. But it's how has COVID really affected us? How has it, in essence, broken the public health system? And how has it alienated one another just through inaction, miseducation, misinformation, skepticism, conspiracy theory, you name it, is what we're going to have a short talk about, today. Please leave comments for me. I am more than happy to engage in conversation because I think it's the only way that we get through this. I had very good discussions, with family and friends because I really wanted to get the insight, not just of myself, but of other people who have like experiences and who have like feelings, but then also to see the other side of the spectrum and to see people who do not have like feeling and like experience. But at the end of the day, I truly believe that from a public health standpoint, that the COVID 19 incident has indeed broken our public health system here in the United States. And is it fixable? Is where the question of the greater minds need to flow. So, once again, my name is Dr. Keith Lindsay. I am a public health practitioner, educator, professor, finance person, and I have been at this for quite a long time. And even in my now going on 19, 20 years of doing public health talks and giving counsel to people about public health, never before have I seen this situation, pop up. Never before have I seen the the unsurety of a country, the unsurety of a people like this time. And so, what is really the essence of public health? Going back to the World Health Organization, giving us a definition of health. But public health is built on the principles of education and prevention. And so, in the lack of good education and the lack of sustainable prevention, you have a breakdown of this system. So, why is that important? It is important because public health deals with three things, in my personal viewpoint. It deals with promotion. How do we promote the healthy behavior that we want a community to see? Two, how do we package this information so that people are able to make logical choices about what is transpiring? And three, what is the position that public health has to take that encompasses packaging and promotion? So I call them the three P's, and it is essential to any type of public health intervention. One, you have to know what ground you want to stand on. Two, how do you package this information based on the community or based on the segment of a population that you need to reach? And three, how do you promote it? How do you engage people in order to buy into the change or to buy into the behavior that you're ultimately seeking? So, public health is a community centered, people focused discipline, period. Now, public health is both art and science. Well, people might say, well, isn't public health just science? No, public health is science because, yes, people do get sick and we have to collect data and we have to do a lot of other data diving in order to break out and parse numbers and parse data so that we're able to find out trends and statistics and infection rates. But public health is also an art. because it's not a cookie cutter solution for every problem that we face. Some things require a lot more attention than others. Some require a lot more hands-on work. Some require a lot more community participation. But the key goal of any public health intervention is community buy-in. If you cannot buy into a community to explain to them what you're trying to do, it is going to fail. That is why education is so important when it comes to public health. And even in this COVID, we have seen where the lack of education has driven people to extremes. And this is an extreme on both sides, whether it is to mask or not mask, to be vaccinated or not to be vaccinated, to open or close a business, to scale back a business or have it be full blown. Because of the lack of education, it then creates misinformation. And then it creates these platforms. I wouldn't even say a platform. I would say more of a pillar that people drive into the ground. And they base their whole structure on this pillar of information that they feel they have. But that information may be incomplete. But regardless of it being complete or not, it is all they know at this present moment. And so they cling to that, and that is what they go by because this is what they think is right. And so we do see this. Everyone has a sense of individualism when it comes to what is right, what is wrong, what option should we take. And is that wrong? No, it's not. Is it best practice? Probably not. But at the end of the day, we are all have to personally take an account for everything that we see, everything that we're doing, whether it be a source of action or an inaction. There is always a response to it. And so we have to decide what is the response that we want to see, what is the desired response that we want to have, and then how do we find the most sensitive, culturally competent way to make it happen. That wraps up education and prevention all at the same time. But how does public health differ from traditional medicine, even in this COVID? The medical side of the world is a virus, COVID, novel coronavirus, that is ever changing. As more information gets poured out, decisions change, things change. But from a public health standpoint, we're looking more at how do we prevent people from getting sick from a disease that we know is present in our population. And how do we best go about educating people about the disease, educating people about prevention so that they can make the right choice. But see, that's where the lines sometimes get blurred. Medicine seeks to cure you from symptoms. Public health seeks to prevent you from getting the symptoms to start. And so this is where we blend in together, but then this is also where we separate. Because it is that community intervention that where you hear people say, I don't trust the science. Well, that's the medical side. The public health arm is, well, we have this disease out here. We know that the information is ever changing about this virus. But what is the best practice for prevention that we have with what we know at the present time in order to make this situation better? And those are the options that should be placed on your table and placed on our tables to see how we overcome this. And so Public Health 101 deals with that picture. Is how do we interpret data? How do we interpret what we see in the environment, transform it into an educational piece, and then deliver it to the people? So public health is for the people. It is by the people. Public health is of the people, because the two words says it all. Public, which is all of us as a community, and then our health. Though health is an individual component, public health is that collective voice. And so as COVID-19 has struck us, we're thinking about how has this community voice been quieted? How has it been hushed? How has it been muted? How has the voice of public health become an untenable voice in the choir of our community? And so the COVID-19 response has been a hodgepodge of mess from our medical community, silence from our public health community, overreach from our governmental sources. It has been a perfect storm. And it has been a perfect storm that has created a lot of mistrust amongst the people that collectively they are trying to serve and to protect and to educate about this coronavirus. And so sometimes there's too much information that you can give. But as I was going through school and working on my master's and working on my doctorate, there was one phrase that I think would settle a lot of people's minds and hearts in their family concerns, in their individual concerns about coronavirus. The solution is not to make things up or to try to hodgepodge a solution. Sometimes the best answer to a question is simply, I don't know. We don't know. But from a public health standpoint, we're trying to feed you enough information to give you enough education, even if it's just an overall quantifiable talk about a problem to help you move towards a solution. And they're very complex problems. This coronavirus is very complex. Alpha variants, Delta variants, Lambda variants. Where did it originate? Why is it here? Why is it there? All of these fights, they suck the air out of a room. And then when the fight begins, the lack of morale begins. The lack of respect begins. The lack of community ends. And so what we see is we fall into a hyper sense of individuality, where we only think about me, mine, and there's nothing else. And so then when we dig in on that platform, the over information that we got, we now want to figure out, I'm not doing this because I don't trust this person. I don't trust that person. I don't trust this system. I don't trust this governmental entity. Then the mistrust that builds erodes whatever sense of community we would ever hope to achieve. And so our political responses is also something that drives us into different directions. Political stances on mask wearing, political stances on school, political responses on businesses, political responses on jobs. All of these things are wedges that drive people apart. Why? Because in the absence of knowledge, chaos reigns. In the absence of education, miseducation flourishes. In the absence of surety, it's just a breakdown of any foundation. And so the coronavirus has done a very good job in doing that to us. And so when the political bodies make decisions to try to score points with the people, Yeah, I'm protecting your liberty. Therefore, you don't need to do this or listen to this person. Or I believe in the fundamental tenet of government and their ability to protect the people. So I believe that we should do or we should not do. Then you see where that argument gets overblown. We see where the lines get drawn in the sand. And it's almost like I dare you to cross this line. But I want you to be abundantly clear about this one thing, that no matter what political stance you take, that no matter what social issue you think you want to conquer, the coronavirus does not care about your status. It does not care about your money. It doesn't care about your resources. It doesn't care about your religion. It doesn't care about your race. It doesn't care about your ethnicity. It does not care about your political affiliation. It does not care whether you live in a rural community. It does not care if you live in an urban community or a suburban one. It doesn't matter if you live in a house. It doesn't care if you live in an apartment. It doesn't matter if you live in your car. This virus is no respecter of person. And we are all afflicted by this in that 6 degrees of separation. For certainly by this time, we know someone who has been afflicted by the coronavirus, who has lost their life to the coronavirus, who may have gotten the coronavirus. But there, the misinformation begins to flourish. Everyone runs to the internet and runs to social media. And everyone becomes I call an internet doctor and a street scientist. They know more than anyone. But they use those vehicles to build their false assumptions on both sides. And so it does not drive us to better solutions. It drives us to wedges, and it drives us to create even more cataclysmic responses, insensitive responses, uncaring responses, because we're trying to figure out what is the best way to try to get some of these things accomplished in ways that we cannot understand. And so now that drives us to what will our future be? What will be the future of this America in the age of Corona? What will be the functioning tenets and beliefs of this country in the age of coronavirus? That's going to be up to us. But I do believe that no matter what situation gets brought up, there is no mandate that can be put into place. You cannot force the will of the people. The people have to be educated enough to make decisions on their own. Notice I said educated, not scared, not made to be fearful, not meant to be apprehensive, not meant to be, not trying to be deleterious, but how do we come to good, hardcore educational decisions that will drive us? Because we don't want to see anyone lose their jobs, be evicted. We're better than that because that's America. We should be better than that. Our moral compasses should point us bigger and better than that. And if this is not a time where community needs to embrace each other and come together, there is no better time than this present in these United States of America. But the future of the public health system doesn't rest with the coronavirus. But I do believe that the attitudes and the pointed direction of public health is going to take a very different turn, because now we have to not just combat the educational gaps, but now we have to fight the cynics and the conspiracy theorists and those that believe that public health is here to do you harm. not understanding that public health is the greatest good that could have ever been formed to protect the health and the general welfare of this country and all of its citizens combined, rich and poor, black or white, no matter what your color, race, or creed. Public health is a unifier. It is not a divider. And if people think that public health is here to divide, then you do not understand the true tenet of public health. Yes, public health has taken a lot of scrutiny, and they're trying to be the face. But the face of the coronavirus in this issue are politicians and people who don't understand how public health works. But what we need are more people, more public health practitioners, more people who are trained and educated in public health to stand up and be a voice in the community. That's how true change occurs. That is how true change is going to happen. This is not Tuskegee 2.0. This is not a religious dogma or second coming. This is not a weeding out of the people. But what it is a stark emergency beacon to, if coronavirus can shake us like this, what happens when something worse comes around? And we really need to embrace each other as a community, where the coronavirus has showed us that we are ready to rip each other apart. And we're ready to rip each other apart over a piece of fabric. We're ready to rip each other apart over substance in a vial. Those things have ripped our community asunder. And there has to be some healing. And public health is that bridge. It is that healing salve. But we have to have it in ourselves to understand that, yes, we only get through this when we band together as community. And so as we continue on, it is trust and accountability to each other that is going to be paramount for us to make it through. And so I'm going to break down a little bit more, and we're going to talk about, some more of these more pressing issues. But this was the oversight of what broke this system. And it's not that super intelligent talk that with words that you cannot understand. It's very simple. Misinformation, trust, and accountability out the window created this level of mistrust that we now see. So together we can do it. Together we can overcome it. But at the end of the day, the one word that is going to take is community.